Hey, how you doing? Dr. Mabanta here again. I wanted to address the issue of symptoms and how it relates to chiropractic care. A lot of times I've asked people if they see a chiropractor and they tell me, no, I wouldn't see a chiropractor. I don't have any back pain or neck pain. Why should I see a chiropractor? And you talk to the same person and you'll see that they might have other health issues. They might have digestive problems, a heart condition, skin conditions. And, for me, when I think about that, I think about the effect of what controls the body. And that is exactly what chiropractic is interested in: the brain function, the nervous system, and how it affects the rest of the body. So here's the thing with pain: pain is usually the first thing to leave, and it's the last thing to come. Think about somebody with cancer, God forbid. You don't have pain or symptoms until the cancer is very advanced, until it's almost too late and there's really no treatment, or the disease process is very far along. Also, think about heart disease. When do you notice that you have a problem with your coronary arteries? Is when you have a heart attack. But if you look at that process was occurring for years and years and years before you actually had a symptom. Same thing with tooth decay. You don't feel the cavity until the cavity is severe enough, until it hits the nerve. It decays the tooth to such a degree that it hits the nerve and causes pain. But when did that cavity start? It started a long time ago. The same type of thing occurs with spinal health care. Distortion and misalignment or dysfunction of the spine can occur silently for many years. You might have had some type of impact or force to cause a shift or a distortion in the spine. You may have been under emotional stress for an extended period of time, causing your body to be stuck in that fight or flight mode, which will distort and affect and set up a pattern of spinal distortion. Or you may have had chemical exposure, fluorine, chlorine, air pollution for a long enough period of time to create chemical imbalances, which is, again, another cause of spinal distortion via chemical stress factors. So if you can analyze the spine before those symptoms come, find out where the problems are, correct and restore it, like catching the cavity way before the toothache happens. Stopping the arterial blockage before you have the heart attack is the same thing you'll be doing when you're analyzing the spine, examining it for dysfunction, misalignment, abnormal movement, muscle spasm, perhaps inflammation. Those are all indicators letting you know. Postural distortion. Those are all things that let you know that there's a problem there before the symptoms occur. So that's how chiropractic can be used before symptoms can arise. So a little tip around getting the problem before the problem gets you. Thanks. Talk to you later.